What's up, everybody? Welcome to another episode of Lucas Live. Excited to be here with you guys today. It is Monday, May 4th. I only remember that because tomorrow is election day. So tomorrow, and it's Cinco de Mayo. So I don't know if we're going to have some tacos, some Taco Tuesday. Is it Taco Tuesday and it's Cinco de Mayo the same day? We got to have margaritas and tacos and all of it and party and have a good time. Excited about today. I have some great guests on. I have Dr. LaTrice Snodgrass. I don't know how to say her last name. You know, sometimes you be saying people's name backwards in your head and you be like, I need to say it right. And then I have the one and only Torrence is in the building today, ladies and gentlemen. AKA Jakey Jake. It's Jakey Jake in the building today. I'm so excited. I had to be like, bro, what is your name, man? Like, what did the government code? You put Jakey Jake on your taxes or what? You know what I'm saying? He was like, yeah. No, he said it's Jason Torrence. I said, okay. Man, I'm such a fan of both of these people today as we talk about equity and inequities in the healthcare system. We're going to talk about that today. We're going to talk about fitness and health and just being a part of our community. Jakey Jake, if you guys haven't seen, he has a viral video where he was doing some detective work, you know, on behalf of the Amazon in the Amazon. He was out there in the jungle, and it was more boxes outside that house. Some of y'all's house look like that anyway, because y'all be buying so much from Amazon. It probably just looked like that because you ain't got home yet, right? But it was boxes everywhere. I think I saw it on like World Star or something. I saw it on a big publication. I'm like, that's Jakey Jake. Like, wait a minute, that's him. I hit him up like, bro, that's you. He's like, yeah, man, it was so crazy. So excited about it. Love his content. Love his love for his wife and his family, man. That's special, right? These days to see that and see that in the Black community, Black family, and all that love he shows and shares and years. And we're going to talk about some stuff because I want to hear about these people, not only as professionals, but as their journey in life, because we've all learned some things throughout life, right? We've all come through some things in life, and it's inspiring. And shout out to all my previous guests, because we've had some great guests like Brian Flowers. I don't know, y'all love Brian. I knew I loved him. I didn't know everybody loved him that much. I know that's my guy. Me and him sit and talk for hours. But we really appreciate the love you guys have shown. He had some real transparent moments. You know, he talked about being a minority business owner, and he said when he first started, he was somewhat afraid to share at times, you know, sometimes not wanting to say, you know, I'm the owner. He would pull up with the truck to do the dumpsters and just be like backing the truck up and being like, you know, here go the truck. And then eventually somebody was like, you sound like the guy I talked to on the phone. He was like, yeah, that was me, you know. So he had to learn to own that as a minority business owner. So there's things we're all going through in business and in life that we'd like to talk about on here. We laugh, we have fun, we learn, we hang out. Now, here's what we're going to do. We got to share this broadcast. I got to share it too, because I'm live on my Lucas Tyndale page. Sometimes I go, and we're on YouTube at Lucas Live Media. And sometimes I try to go to both pages, but then it splits the group up, and I'm working it out. Okay, year 6, you know what I'm saying? The algorithms change, so you gotta study and do what makes the most sense for the algorithm. What makes the algorithm happy is what you gotta do. So I'm gonna go to my Lucas Tyndale page, and I'm gonna go to the live broadcast. Let's see, there we go, we in there, and then I'm gonna go ahead and share this over to my Lucas Live Media page is what I'm gonna do to make sure all my Lucas Live Media people who follow me over there aren't like, where is this guy at, right? I don't want y'all thinking I done slept in or something. Like, I'm missing y'all, you know? We will be back also this Wednesday as well with another great episode. We actually have a McKinley High School graduate coming on to make his decision about what college he's going to, and he's not coming to talk about athletics. And I'm really excited about that. Y'all know I love sports, right? And I love my athletes, but I think it's important that we also support these young people as they are going off into college. He's making a decision. Kids, they all got to make a decision about where they're going to go to college, right? So he has to make that decision as well. So we want to help support that and help him make that decision here live. Okay, there we go. I only been doing this for a long time. They was in the studio this morning, and I was telling them, no matter what, no matter how long I've been doing this, no matter how many years, every morning, it's a scramble. It's a bit of a scramble. I mean, you know, it's some buttons to push, there's some things to do, put the description in the thing, make sure the sound is working, make sure the lights is on, make sure the cameras is going, make sure I got my coffee. Shout out today to SARTA. Ladies and gentlemen, tomorrow's an election day, and I believe that we are in a time where there's some important things on the ballot. Now, I know sometimes these I don't know the proper term. I want to call it in between elections, but it's not a November election. There's no national election per se, but we have some really important state issues and some state things going on. One of them locally for us in Stark County is issue 4. And we want you to vote yes on issue 4. Yes on issue 4. When you go see issue 4 and you're like, was it yes for it or no for it? Don't go in there getting confused. Don't go in there messing it up, because you get it together. It's yes on issue 4. If you believe public transportation is something that's needed in a community. Now, most of us, a lot of people in Canton be like, man, I need to get out of here. I need to go to a bigger city. Well, if you go to a bigger city, there are tax dollars going towards the public transit system. Even when you go shop in Chicago and you're on that Millionaire Mile or whatever it is, you're going down past all that, you're going in all them places and shopping, the money that you put into buying things and taxes and things also helps fund public transit. Same thing here. We need money for our public transit system because it is a vital part of our community. It is not a property tax. It is a slight addition to sales tax, and it's going to make a big difference in our community. So vote yes on issue 4. I also want to shout out a couple other people. Now, this is not a political show, right? But there's people who I know and love, and I mean, that's what it is. Sometimes I support people or talk about people, and then like in politics, and people come to me and say, well, did you have their opponent on? I'm like, I don't know their opponent. I don't know them. I literally don't know them. Okay. So the people I have on are people I know or trust or like for whatever reason because we've connected. So a couple people I want to shout out. Krista Allison is running for the 49th District, Ohio seat, House of Representatives. I don't actually live in the 49th District. I live in North Canton, and I'm in the 48th District. But who I'll be voting for is Sue Grabowski, who is also a friend of mine, somebody I know. So shout out to Sue Grabowski and what she's done. She has a great marketing company. I do marketing and other things. She's been in this community a long time. She's a treasurer in Lake County. I think that she's oh no, I'm making up stuff. She's the head of she's the head of the FBI in Lake County. No, she holds a position she recently got elected to in Lake County, Lake Township, and just a great person. Seriously, honestly, somebody who I've talked to, known, worked with, phenomenal lady. Shout out to Sue Grabowski. Shout out to Krista L. Allison, and shout out to issue 4. Just those are 2 people and 1 issue that I'm particularly caring about. I've met some other people I don't want to speak on, some of the judges and other things, but let's get out there and vote tomorrow. Make a plan to vote. And if you don't know how or where to go vote, if you don't know where to go vote, I'm going to make sure we get that information out to you. There's a nice little app. It's a little bit old school, I ain't going to lie, but there's a little app where you can plug in your information and they'll tell you, yeah, you go to the school around the corner. Yeah, you go to this place or that place to go vote. Okay, ladies and gentlemen, we want to make sure you guys do that. Good morning, everybody jumping in the comments. My Aunt Gloria's here. Good morning. Thank you so much for always being here. Ron, thank you so much for jumping in here. We have a great show today. Make sure you guys hit those likes. Make sure you guys share this broadcast. If you're watching on YouTube, hit the share. You can't share it to YouTube, but you can share it to your family group chat or something. If you're on Facebook, hit that share it to your page, share it to your family and friends, hit that @ symbol and tag a family member or friend and say, hey, check this out. He has some great guests. Dr. LaTrice Snodgrass and Mr. Jakey Jake is in the building. We're going to start this morning with Dr. LaTrice. We're going to talk to her here in just a minute and hear more about what she has going on. And we're going to get to know her a little bit, all right, if that's all right with you guys. All right, ladies and gentlemen, I always say this. It's so funny because I think it's a very common statement. It's like, without any further delay or any further ado. I don't even know what ado means for real, but I be saying it though. You ever be saying some junk, you don't know what I mean? Without any further ado, because it sounds fancy. Without any further delay, without any further ado. Let me turn my song off. Y'all I hope y'all been listening to my little jam, my little song I made. I hope y'all like that. I don't know. What's up, Marcus Billy, my man? What's going on, brother? What's happening? Y'all say what's up in the comments. Let me shout you out while you guys shout us out and show us some love. So, all right, my comments just jumped all the way across the screen. No big deal. I got multiple monitors going on. So if y'all noticed before, I was looking kind of over here at the monitor. Then I had the monitor kind of in the middle, but that made my camera way up here. So you could only see me from like here up. Looked like I was coming, a jack in the box, barely coming up out the thing. So I moved some stuff over. I got multiple monitors going on. So I'm going to see y'all here and my guest is here. We're going to make this work here. All right, without waiting. Yes, thank you, Aunt Gloria. Without waiting, we are going to go ahead and get into the show. And let me welcome on the show Dr. LaTrice Snodgrass. Good morning. How are you?
Good morning.
Good morning. How you feeling this morning?
Feel good. I was vibing to your song. You got to send me so I can download it.
Okay, I'm going to send that to you. Okay, I'm trying to get some downloads. I'm trying to get, I'm about to be like Michael Jackson out here, They're going to make a movie about me and my one song. I like that. I appreciate you. So, Dr. LaTrice, for people who don't know you, let's just open up a little bit about who are you, where you from, and are you a real doctor? What's a doctor? You know what I'm saying? People like, every pastor I know is a doctor.
Right.
They got it.
Right. So I say a million times a day, not that kind of doctor.
Okay.
So look, I was
Yes.
born and raised right here in Canton, graduated from Timken High School in 91.
Love that.
So I am a Canton
I
native.
love it.
I have a doctoral degree in healthcare administration.
Love that.
So people call me, well, my ear, I'm like, yeah, I'm not that kind of doctor.
Nah, you're like, don't call me about your ear infection. You better call your
Call my niece, she a nurse.
Okay, right. She'll help you out. So your doctorate is in
Healthcare administration.
healthcare administration. Love that. Born and raised here, Canton, Ohio.
Yeah.
You said Timken?
Timken. I graduated from
graduate.
Timken.
Graduate.
Yeah,
Love
yeah,
that. Love that.
yeah.
Love that.
So I grew up on the northeast side of Canton in Chips. Back then we called it Rainbow Acres.
Okay.
And so we were split. So the front of Chips went to Kansas City schools, and the back of Chips, we went to plain local schools. So I was at Taft and Glen Oak, but then we moved into the city my junior year in high school. And so that's how I graduated from Timken. But in my heart, I'm an Eagle.
Are you? I was gonna say, and that's a little bit different, right? It's a little different going from Plain Township back to Timken.
It was different.
What was that like?
It was different. It was different. So one thing I noticed back then, I don't know about now, and I don't know where to look. So I'm just gonna look up because he got 9 million. It's techie up in here.
You just look at me.
It's official.
We just talking. Oh, good.
So it was different. I don't know about now, but back then, what I did notice is that coming from Plain to Kansas City, some of the things I was doing then at Timken, I had did books and different things like 8th, 9th grade. So Timken was very easy for me. I didn't have to study too much, right? I don't know how it is now.
Right. Well, there ain't no Timken, so don't worry about that. Ain't no Timken, they went ahead, it did disappear. So you don't got to worry how it is in Timken now. There is no Timken anymore. No, I think they actually built a Timken Elementary or something. They built another school they're calling Timken.
I don't know.
Shout out
But
to
it was
Timken.
cool because I used to like growing up with like Tammy Dudley and Janeri Johnson and Sherwood. I would walk.
Janeri.
Yeah, that's my love her.
Yeah.
I would walk from Chips. Me and Tammy would walk from Chips to the southeast side. So I was so going to Timken was okay.
You already knew the people.
I was already with.
Right.
Yeah.
I love that. So,
Or ride the bus, Sarda.
Okay, shout out to Sarda.
It's before, yes.
We go sing the song.
Yes.
So growing up here and then going on to get your doctorate. Okay, so first of all, for some people, I mean, high school is tough sometimes to get through high school.
Yeah.
Then going to college, it's like, well, maybe go ahead and get this associate's degree, maybe or get a bachelor's. For me, I always said, man, I am not getting a doctorate in nothing. I said, I got to go to school almost as long as I went to school already.
Right.
I want a doctorate I want one of them honorary doctorates. I remember back in the day, I think it was like Bill Cosby or something got an honorary doctorate. I was like, how I get one of those? I just want a doctorate that they just hand me. They like, you've been doing good. Here's a doctorate in something. I'm looking for one of those. So what compelled you to continue your education, and did you go straight through?
So I'm gonna tell you, it truly was. Okay, let me tell you the journey. So I started off in healthcare as a medical secretary, then I became a medical assistant.
Okay.
And then I moved into leadership. And at this time I had a master's, and I noticed I didn't have the word for it at that time, but I was beginning to notice inequities. Black and brown people were not receiving the same level of care. People were dying from things that they didn't have to die from, or being chronically ill and they didn't really need to. So I started noticing these differences, even though I couldn't put a name to it at that point.
Right.
And being an African-American female, I knew to get to the point in leadership that I wanted to get to be able to make a difference, I needed more than those that were in the space that didn't look like me. So that's why I went for a doctor, because I wanted to be at tables where I could make a difference, where my voice mattered, where I could lean in. So I knew I have to have more. That master's isn't going to work when I'm going up against Sally with blonde hair and blue eyes, right? Unfortunately, that was my reality.
I appreciate you saying that. And I think we don't often know about the inequalities in the healthcare system. Like we hear about it, they say like, even like the infant mortality rate in Black homes and things is significantly higher. They talk about the care for men and women, but often like more pain tolerance and things like that. And maybe I'm just throwing these things out there. So why don't you educate us on what are some of the things that that you're aware of that may be true inequalities that are literally existing right now that we need to fight back against in the healthcare system?
So, Okay, so these are things that we don't like to talk about. Let me say
I
this
appreciate you
first.
talking about the stuff we don't like to talk about.
Yeah, it's okay.
I'm seriously.
So let me say this first. I feel very strongly that the folks, the doctors, the nurses, and the folks that are in this space, they want to do the right thing.
Okay.
They want to take care of people. They want to create healthy communities.
Yeah.
Unfortunately, there are things that prevent them from being able to move the way they want to move. Healthcare is a business. No margin, no mission.
Wow.
Right? So you do have to balance it.
Yeah.
But there are definitely, so growing up, we always hear, treat everyone the same, treat everybody equal, don't treat people different. But in healthcare, if you treat everybody the same, somebody is gonna not thrive.
Because everybody's not the same.
Everybody's not the same. We need different things. There are screenings, so like mammograms and different screenings. Black folks need to have some of these screenings before white folks because there are differences, right? So we need to understand. So I wrote a book back in 2021 called Justice for the Health of It, where I pointed out some of the things that were happening during COVID because Black and brown people were dying at higher rates.
I don't think I knew that.
Yeah. There was disproportionate deaths, and Oprah Winfrey actually did a documentary on this because it was real, right? Some of it is because of implicit bias. There were actually, you talked about pain tolerance. There were actually studies where it's not funny, but I'm laughing not to be pissed. There were studies of doctors who took surveys that actually said that Black people our tolerance to drugs was stronger based on our makeup. Right. So this is true. Like these things are true.
There's some people at the highest levels of government in the health system these days that are saying that in front of Congress and stuff. They pulling them up like, well, what do you think about this? Or what are we doing? And when we strip out DEI, we're saying we can't look at races differently and assume that there are differences. And you're saying in the healthcare system,
it happens.
It is happening all the time.
Because I'm gonna give you this scenario. You're a physician, you have a person that comes into you, they need to lose a little bit of weight, right? And you're like, okay, I know you're on Medicaid, so you can't afford a gym membership. Now you're doing this rationale in your mind. So a well-intended physician, you say, go walk. When you get home from work, just go take a walk, walk around your neighborhood. But I live on the south side of Chicago where there's no green space, no sidewalks, and liquor stores on every corner. I can't go outside and walk. So you as a doctor, you were well-intentioned, but from the frame of your existence, you can go walk. Well, everyone can't. And this is how sometimes inequities sneak into healthcare because I only know what I know. Right? Implicit bias. And your implicit bias is that thought that comes to your mind automatically without you even really thinking about it, right? Based on knowing what you know. And it's going to trump your explicit bias every single time. So we have to train ourselves not to go to our go-to thought. So if you tell me I can't train on bias or I can't train on DEI, you are stagnating our system because you're taking a tool out of my toolbox that I need to help this community thrive.
Wow. With that going on, what do we do? Like, if we can't talk about it, there are truly inequalities in the healthcare system. What are some things people can do to advocate for themselves?
We have to, this is biblical, study to show yourself approved, right? Study, understand we just go to the doctor without doing any research on this doctor. We spend more time buying a loaf of bread than we do choosing our healthcare provider. So study them.
And then real quick, then there's the issue of if you are on Medicaid or something, then you got to find ones that will take it. And then so now your pool of doctors is smaller. And you're like, well, Dr. So-and-so said he could see me. He said he'd take my Medicaid. And I'm going to just get in here with him. And I'm going to just ride it out. And I'm going to trust this person coming in this white coat with this little thing. And they seem professional. And I'm just going to believe that whatever they say is true. But that's not always true.
It's not always true.
Because they're people. And I think what you said was, it doesn't mean they all have ill intentions.
No.
But there is a real issue still.
And even though the ill intention isn't there, that impact is still the same. So at some point, we have to take accountability in our health journey. we have to get, there's a power gradient between you and your physician, but your physician wants you to be an active
What do you mean by
participant.
power gradient?
So you have on this white coat, you're this MD. So that power,
The
the
dynamic,
way
the
I
power
look
dynamic
at
is
you, the way I look at you, you're elevated. You know, I think about my grandmother. She would have never questioned a doctor, whatever they say. But then she would go home and say, "I ain't gonna do it.
I don't care what that doctor says.
I ain't taking that."
Fry that chicken. Let's go, man. Let's go. Get that
Right. So we have to get comfortable, and we need to interview our doctors, ask questions. Like I think about new mothers, they have lists of questions. And when they come to that pediatrician the first time, they running them questions down. We have to do that for ourselves.
That's fascinating, because I don't think a lot of us even think, I don't want to say we don't think we have the right, but like you said, that power dynamic is something. And I think for me, I would say growing up as a minority, trying to not be the aggressive, angry, anything. Like I feel like it's funny because I always joke, like I had a year last year where I was falling out with people because I was just fed up.
Yeah.
I was just tired. And some people I fell out with, I regret, because it was like, I shouldn't act like that. But I was just so tired of holding my breath my whole life out here, just trying to make it in corporate America and all this stuff. And it's like, no, for real, I'm from 10th Street. Like, for real, like I had to be tough. Like, I'm not no punk. I'm playing nice in the movie. That's what I always tell people. Like, I play nice in the movie of life, and I choose to, every day. And I choose to set an example for my children, and I choose to be a good husband, and I choose to. And I'm not mad that I choose that, but stop playing with me. Right. So I have this part of me that's like bubbling up. Like, man, one more person say, well, they could be like, I didn't expect Lucas Live to be locked up. Lucas Live from lockup and lockdown is coming on next month. It's gonna be the new episode of Locked Up. But it's like, it's in there, but that also makes me less challenging of things.
Yes.
I was taught to respect authority. I was raised in that kind of community family, so the doctor say something, I might be looking at them like, all right, I don't know, but the doctor knows best.
Yeah.
And what you're saying is it's not about that. It's about knowing you.
It's a relationship.
Yeah.
It's relationship, right? And I want to go back to something you talked about, like that bottled up that we have as Black and brown people. May is Minority Health Awareness Month. And
I knew that. Perfect time.
Yeah. And mental health is so important.
I love
that stress that we deal with, that inability to, that imposter syndrome that we have to walk through life with. Like you and Jakey Jake was kind of talking about things that are buttoned up and things that we can't say. That creates trauma. So we talk about PTSD and we think about veterans and war, but PTSD, I feel like a lot of our Black men are walking around with PTSD from being pulled over, from being followed around, so we have to deal with our mental health. We need to embrace therapy because it helps you deal with that stress that you have, that bottle up, so that when you are with that doctor, you don't go aggressive. You just use your words to explain how you're feeling, right? Because when we are angry, then we blow. Now it's too late because I done acted a act up in here, and now I can't come back to this doctor. I still got diabetes, and next month my foot get cut off.
I still got the sugar and everything. My sugar's still messed up, and I'm over here cutting up on the doctor, and then I cut off my foot. Like, that's a real situation. You're right, because we are walking around with a lot of trauma and smiles.
Yes, and we can't. That's not healthy.
Yeah,
that's not healthy.
I appreciate you saying that too, because I do believe, and this is an issue across all communities, but I do think in our community specifically, I know for me as a Black man, it's like I was trying to say this to Danny. Shout out to Danny on my team. Danny her and her dude went to Belize. And it was like a lightweight hurricane popping off.
Oh no.
And Danny like, let's go eat. And he like, I guess, you know what I'm saying? She like, buddy from TikTok over there cooking. Let's go over there and get some content and eat all this stuff. And he was like, hurry up. Or at some point it was taking too long. The weather's getting worse. And he's like, we gotta go. And she was just kind of like, I didn't understand. She was like, he was so like intent on like, we gotta go and whatever. And I'm like, because as a man, for me, I feel like I'm always in protection mode. So that's another, I don't sleep the same as everybody in my house.
Right.
I'm laying there like, somebody come through here, they gotta come through me.
Right.
But I gotta hear them come through here. I gotta be ready for them to come through here. The ring go off. Amazon dropped something off this morning. I got a new cord for the thing, and they dropped it off at that 4 a.m. to 8 a.m.
that friend
Don't
window.
be creeping around my door no 4 a.m. Okay, Amazon, whoever you are, I'm Jakey Jake done found some bodies up under there. Some of y'all suspects. I don't know. So I'm like, that thing go off. I'm up looking around, checking, making sure ain't nothing weird going on. So that's a level of trauma. There's like this constant this intensity. And I think coming from a community we come from, a lot of times we also don't always embrace counseling and the mental health side. So going back to that, what are your thoughts on how do we get our people, our family, our fathers, our brothers, to embrace, like, I know you talked to your buddy about it while I was watching the game, but you didn't really deal with it. How do we help them do that?
So a few things, and I think we have to be strategic. We have to play chess, not checkers. We need to look to who are our unofficial community leaders, our barbershops. Go into our barbershops and turn our barbers into ambassadors. Educate them, give them the tools, give them the resources. So when that person is in their chair, they're having those conversations and they are normalizing it, right? Our churches, our pastors and the people in our church, they need to start talking mental health from the pulpit.
And not just not just a spiritual, God will work it all out, but maybe he worked it out by getting you some real tangible help. Not just some spiritual hope you heal tomorrow, but you keep coming back here broken every week.
Like, shout out to my pastor, Pastor Sherman Martin at Union.
Love him.
He talks about going to get a therapist. Talking, it's both and. Get you a therapist and pray about it. It's not either or.
It's like, go to the gym and we're going to talk to Jakey Jake. And then you be like, hey man, I can't work out, brother. I'm just praying that the Lord will take these pounds off. Where that chicken at? Right? Where that fried chicken at?
Faith without works is dead. Come on now.
Come on.
Yeah. And so Carlton C said something in these comments that I really like. He talked about compassion. That's huge. That's in physical health and mental health. Whomever you're dealing with in the medical profession, make sure they have compassion. If you go in and you're talking to somebody and you feel like there is no, and this could be black, brown, purple, yellow, or green. No compassion, fire them, get rid of them. Right? Because compassion creates equity. If a person has compassion, they're going to take that extra step to make sure you have what you need to thrive. If I have no compassion, I don't care. Right? So we're not creating equity without compassion.
I love that. Let's talk about Beacon.
Yes.
For people who don't know about the pharmacy, number one, where is it? Why does it exist and who does it serve?
Yes. So Beacon was founded in 2002 in the basement of Mercy Hospital. It was funded by Sisters of Charity, Mercy Hospital, and the Austin Bailey Health and Wellness Foundation.
I did not know that.
Yeah. And it was founded because you can go to the hospital or to the doctor if you don't have insurance and they will see you. But when they give you that prescription, it is nothing more than a piece of scratch paper if you don't have insurance. So they noticed, they identified this critical gap, right? So Beacon now is on 13th Street, 2525 13th Street, right next to Lehman Middle School, right beyond, in between the crisis center.
Over there by the stables.
Over by the stables, then it's us.
Over by Lehman, Westbrook Park, over that area.
Right
not far from Mercy, really.
Right, exactly. And so we were at the Goodwill for about 13 years, and then Cleveland Clinic Mercy donated that building. We did a $1.6 million capital campaign and raised the funds to renovate it.
Never knew that.
Yeah, and it brings me joy because it is a very nice space. I grew up on Medicaid, welfare, subsidized housing. And I remember walking into clinics that were dank and dingy and horrible, right? So this is a nice, bright space. It is welcoming for some of our patients. It may be the only nice place they get to come to that day. I think that that's really important. So it's important to me that it's a nice building. So thank you to Cleveland Clinic Mercy for donating that building and everyone that donated for the renovations. So last year, we served 777 people, dispensed 24,000 prescriptions that were valued at $4.9 million, right? So we serve folks who don't have any insurance or that are underinsured. And what I mean by underinsured is you have insurance, but you have a $1,000 copay. So you might as well not have insurance. You can't access it. You can't access it. And folks that are living 300% or below the federal poverty level. So like for a 2-family household, that's about $54,000. But the need is great. And if you don't need our services, the way that you can help us is Governor DeWine in 2023 passed a House bill that allows community members to donate unused, unexpired medication. So if you have, so say for example, your doctor gave you a medicine and it doesn't sit right with your stomach,
Right.
you can donate that to us. 95% of our medicine is donated, and it comes from something called the Ohio Drug Repository. It's not a place, it's a concept. It allows hospitals, nursing homes to donate medication to charitable pharmacies. And then we're 98% grant funded.
Absolutely fascinating. Let me tell you, I didn't know those things. Glad I know those things. Somebody out there is like, I don't know though. Did she just say me or not? Like, I don't know. She said some stuff. I don't know if that was me though. I don't know the way my leg is acting. I don't know. I need something. I've been using this Tylenol forever. Again, how do you know if you qualify?
Yep.
Is it like if you come in and you're over income, do you be like, go down to CVS, they got you? Or like, how does that work?
So here's the thing. My goal is to qualify people. So I have some drugs that are restricted because the program that donated it has strict guidelines on your income.
Okay.
Then I have a whole pool of medication that is not restricted. My goal is to always help people. So we're going to do whatever we can to get you qualified. So for example, we have folks that come in sometimes and they'll say it's just them, but then they're like, in talking to them, well, I take care of my grandkids. Okay, then put them 5 grandkids on your application, because now that 54,000 is stretched between 5 people and not just you.
Right.
So having conversations. But I say always call me. Just call us. Give us a call.
And when do I call? Do I call when I just left the doctor and I have a prescription? Most of the time when I leave that doctor, it's not like they put the price tag on there.
No.
And now they're like, this going to be, because they don't even know.
Right.
They got to run your insurance and all that. So you get to the pharmacy and I just had a tooth extracted a couple weeks, like a month ago. I almost died. I basically had a baby, y'all. It was the worst pain I had ever been in. All weekend I was laying there I'd never been closer to the Lord in my life. We was locked in. I'm like, won't he do, will you do it?
I almost had a baby.
Oh, I thought I was dying. So anyway, and they gave me the medicine and I went to the pharmacist, right? And it was like a couple different prescriptions. And I was thinking they could have said $4,472,000. And I would have been like, man, I'll be back to work here tomorrow, but please give me this stuff. I had no idea what it was going to cost till I got it.
You don't.
So you don't know. So when do people contact you? When they get that slip and they're like, well, this might be $5, this might be $500.
Right.
Or after they walk into the pharmacy and they're like 500 and then you moonwalk out of there like Homer Simpson into the bushes, like, I guess I ain't going to be healthy then. Like, when do they contact you?
So if you have no insurance, contact me as soon as you leave the doctor. If you do have insurance.
As soon as you get a doctor?
So here's the thing. We're just like your Walgreens or your CVS. You have to have a prescription. We are licensed by the Ohio Board of Pharmacy. Right. So if you don't have any insurance, you can tell your doctor, electronically send this script to Beacon.
Okay.
Or if they give you paper, bring it to us.
Okay.
If you do have insurance, yes, take it to the pharmacy and see what the cost is. Okay. Because sometimes they may have a generic version that is affordable. But run it first so that you see, because maybe you can't afford it.
I love it. Shout out to everybody in the comments. We see you guys. Doc is going to stay here with us. We're going to wrap up here in just a minute and get Jakey Jake here in the building. And Doc, I really, a couple things, I think. Number one, and I say this to people, and I think there's times where it's a little bit different. Like, I have to have you back, right? I want to say that.
Okay.
And what I want to say about it though is, I mean that in that I think there's some things that I need you back, like I need to go over to my correspondent over here and I need her to tell us what the heck is going on right now, because the federal government just said this about healthcare. And I need somebody to give us some insight from our community. And maybe even it's virtual or whatever we got to do though to keep this conversation going, because I think we need to know this. Now I have one more question for you, because this is just my real thoughts.
Okay.
Right?
Okay.
Because I'm just a regular person. As you can see, a lot of stuff is funny to me, but I'm like, yeah, my grandma would have some stuff in her cabinet too from 1972. You know what I'm saying? I'm like, I don't even think that Tylenol works anymore. Grandma, them Band-Aids don't even stick anymore. What are we talking about donating medicine that's you found in your cabinet? It's all in the wrong bottle because somebody done mixed it. It's in that little pill sorter. And they're like, yeah, these grandma's things. I don't even know what this is. Doc, can you go ahead and prescribe this to somebody? And I come to you and you done gave me something that make me grow another arm. Okay, help us out. What happens?
So what happens is every pill has markers on it. There's numbers. You probably don't pay it any attention, but there's numbers. So our registered pharmacist has software and tools and training that we're able to identify what that medicine is. Now we will, if you don't bring that medicine to us in the original bottle, we're not gonna take it.
I can't bring it to you out of my pocket.
No. It has to be in the original bottle with the label on it, right? So that we can do some verifying and make sure but this was a federal bill that was passed. So there are checking, and I always get this question. It's a good question because I would ask that question too, right? But there are checks and balances in place that we're able to make sure we are dispensing what we're telling you we're dispensing.
I love it. I love it. So if we have medication and we do have it in the bottle and it's not something that we're using anymore, are we looking for an expiration date or bring it to you guys?
Yes, we do not take expired medicine.
So I can look at it and see if it is expired.
You can. That's
but if I don't know, I could bring it in.
And we'll tell you this is expired.
And we could, you could be like,
thank you, but no.
Thanks, appreciate you with your little donation, your little expired stuff. Thank you. Right. I appreciate it. Shout out to people here in the comments. Citizens for SARTA. Yes, on issue 4, ladies and gentlemen. What's up, Citizens for SARTA? Thank you guys for jumping in the comments. Tomorrow's election day, ladies and gentlemen. Make sure you guys get out and vote. What's up, Shawnee Wiggins? What's up? What's up? What's up?
Sis.
She said, "Love this."
So you know what, Lucas? I want to say one more thing. I know it's my
say one more thing.
I know it's my cousin's turn.
Don't be busting up his time. Me and him gonna
right.
Our time too. Then okay, go ahead.
Look, I said my cousin because I told him. I said when you share a cousin, me and Jake we share cousins. So when you share a cousin in our community, that make you cousins.
That make you cousins.
But what you're talking about, SARTA, another thing that creates inequities in healthcare are social determinants, barriers of health. Transportation is huge, right? So I have to say this. Just give me 20 seconds.
I know.
So we may think that this bill, because those of us that are blessed and fortunate enough to have transportation, we may not think that this not bill levy impacts us, but it does.
Yes.
So the people that are getting to their doctor's appointments, that coworker that's helping you get through your day, people are using transportation. It is a lifeline for our community. So we may not think it impacts us, but it does. So we need to vote yes on issue 4. That is one of those social determinants of health, of employment, without that, our entire ecosystem will collapse, right? We have to have public transportation. So we need to go vote yes on this issue. It's imperative to our entire ecosystem.
Let's go. Vote yes on issue 4 tomorrow, ladies and gentlemen. Make a plan to vote. I think one of the biggest things for me is I'm a very busy person. And as I'm thinking about it, I'm talking to everybody who go vote for issue 4. Get to the polls. It's like, but I got to get to work. And I work for myself and I'm busy. And I got to check in for myself with myself. But you got to have a plan. I believe polls open at 7:30 a.m. There's an app, Citizens for SARTA, you're in the comments. If you guys can put that link to where people can find their polling location, if they're in question at all, please put that in the comments if anybody has it. If not, I'll go back and put it in the comments later. Dr. LaTrice, thank you so much for being here.
Thank you.
It was a pleasure having you.
Absolute
and I'm gonna be calling
pleasure.
you back as my correspondent. Like they talking crazy again now. They talking crazy. We're going to be sick out here in the community. I need your help.
All right. Bring me back.
I'll bring you back. Thank you so much.
All right. Thank you.
Ladies and gentlemen, Dr. LaTrice was in the building. She's going to hang out. She's going to stay here with us. We're going to take some pictures and hang out afterwards. My next guest. Everybody, if you have any other questions for her, please check that out. And again, issue 4, tomorrow's the day. Tomorrow's the last day. Tomorrow's the only day. There was early voting, so if you early voted, you're good. But tomorrow's the day. If we don't vote yes on issue 4, that could be a huge problem in our community. Most people don't realize how many people they transport for medical reasons to and from doctor's appointments. Nobody expects to get a cancer or something like that. And then that doesn't mean your whole family can stop working to take you to treatments every day, right? But the paratransit and the other things they have, are huge. They're huge. They are literally lifelines in our community. So vote yes on issue 4, ladies and gentlemen. And if you're in the 49th district, my vote would go to Krista Allison. And if you're in the 48th district, my vote would go to Sukarowski. But you vote for who you want to vote to. Just vote for. You vote for who you want to vote for. Just get out there and exercise your right to vote. Ladies and gentlemen, we have a guest. Okay, wait, there you go. That link is a big old link right there, buddy. Whew, I don't know what all that says, but that big old link right there, if you click it in the comments or hold your finger on it and copy it and paste it over, you'll be able to go to start, http://start.ohio.vote.org/FBCDABC. You go to that link right there and you can put in your address and it'll say your voting location is here, there, everywhere. Now, my voting location was the same place it was when I voted in the last election or the national election. I'm assuming that's how it is, but I'm not sure if every neighborhood has the same number of polling locations in a May election. So make sure you check that out. And it also talks about forms of ID and what you can do to make sure that you show up to the poll and you don't have any issues. Okay, so let's make sure we do that, everybody. All right, shout out Cork and Canvas. Shout out to my cousin Lisa Lucas. Thank you so much for everything you're doing for this community. And shout out to Chasing Hope House. Had a great event down at Cork and Canvas on Friday. They're ribbon cutting for what they're doing, bringing 10 girls into their first home. And then they got a grant for 1.3 million through Canton for All People. And they're going to be building some housing for girls who are in the foster care system. There's some great things going on in our community. Shout out to the Palace Theater. They were breaking through the wall to build their expansion. We're going to have some bigger acts coming to this area soon. And on Wednesday, we're going to have Wendy from Centennial Plaza on as well, talking to us about all the events going on down at Centennial Plaza. One thing I know is going on is the R&B Fest with Brownstone and all of that going on July 18th, I believe it is, as well as many other concerts, many other events. Make sure you guys check that out. All right. All right. Without any further ado, is that what we're saying? Without any further ado, without any further delay, ladies and gentlemen, I want to bring on somebody who shout out to Nina Parr. Nina Parr was on my show some years ago at my house in my basement. I only had a few people in the basement really on live. She was in there live, her and Elle and her mom and all of them. They was all in there. And she talked about Jakey Jake. She said, I'm training, I'm working out with him. And I'm like, okay, let me follow him. And I've just been an absolute fan ever since. So you guys know me as somebody who does content, somebody who does shows, but even basketball players enjoy watching other basketball players, right? Artists like to watch other artists. This is somebody who I genuinely love watching his content, his thoughts, his posts, his pictures, his whatever it is. I am a fan of it. I'm so happy to welcome to the show my man, Mr. Jakey Jake in the building. What's up, my man?
What up, peeps? How y'all doing?
Feeling great, feeling great. Excited to have you, man. As I said, I've been watching, and I'm gonna jump right in with a question, brother. You was dropping off some Amazon packages. I just want to make sure we start right here. I want to start right here. We're gonna jump into this. We're gonna talk about fitness and wellness. And if you guys are looking for a trainer, this guy is the guy. I mean, getting people together. You can see the way he pushes people, but you can also see the love he has for people. You can tell. You can tell he's like, I'm pushing you, but I care about you. I'm not trying to break you down here and have you not able to go home and take care of your family, right?
Right.
So we're gonna talk about that. But what happened with the Amazon boxes, brother? You brought
Man, first and foremost, I want to say we talk about mental health, right? Had I known that the situation, I would never have posted the video. It's a mental health issue with ordering this issue at the same time. Ordering addiction. So I wouldn't have never posted it, but I'm at work and this is my second time delivering I work for Amazon part-time. I got laid off. I was a supervisor from a machine shop for years, almost 12 years. Got corporate America, you know how everything is going now. Laid off and decided, hey, I worked through Amazon delivering before part-time. I said, hey, just to, make ends meet, kind of
love that.
Do things. I'm gonna go back to Amazon until I get the call back or, see what's going on. Second hot time delivering to this house, man. And the first time I went, it creeped me out, but I really it didn't hit me like that, The second time I went to deliver this house, I'm like, man, all the box, everything that we delivered was there, I mean, this looked like for months at a time, everything that we had delivered. And everything packed. I didn't think nobody lived. I thought it was a vacant house, just some weird stuff going on.
Right.
Like I said, I would have never posted it.
Right.
I post this video, man, and by the time I'm at work, I post this video. By the time I get off of work, it don't went viral. Like, it's trending. It's going crazy.
Right.
So I'm like, people ask me, I asked my dispatcher for a wellness check. I mean, what was going on with the house, first and foremost. She told me everything that was going on. And I kind of felt, because I'm not one to put stuff on social media to try to bash people or try to bring no harm or ill will or light to things like, that was going on. But by the time it went, what it did,
it was out there.
It was out there.
Right.
People had shared it, reposted it. It went crazy. So it was just a house that just gave me the creeps, man. Boxes everywhere, rodents jumping out of it, cat food. It was just crazy, man. It's just still doing crazy numbers on all platforms. People's interested in just like weird, crazy stuff like that. I see. But it was a scary moment. I told them, don't send me back to the house. You know,
serious? Like,
yeah, I'm not going back to the house. So I just the packages out there anyway. I'm just gonna keep them. You know what I'm saying?
Right. What's the difference? What are we talking about? Exactly. I thought it was like my first thought was there are people who order or like order something to a house.
Subscription type thing.
Yeah, try to go in or try to get the stealing. I mean, there's all kind of weird stuff going on with things like that. But that's a fascinating. First of all, it is fascinating that someone has like an ordering addiction or something. Is that what it was? Is that what you guys are thinking? Something like that was going on?
It was wellness check a couple months ago, and as of a couple months on the house, and it's been consistent wellness checks. They don't want no help or whatever, but that's what we found out it was. Mental health mixed with order addiction. And, people got a little bit of money, so they just keep ordering stuff for some reason and just getting it delivered and leaving it outside.
That's a fascinating thing because
Crazy work.
I know some people with an ordering problem, but they get their boxes. They got their stuff. Okay. Doc over here raising her hand. She like, is that a thing? She was just talking about getting help. She about to go get some help for her ordering addiction, but they want their stuff, right? Sometimes it's like retail therapy for real.
Definitely.
Because you get that, we have Amazon boxes in my house all the time. And now most of it is my wife's business and different stuff, right? But every time it's an Amazon box, you'd be like having that hope it's for you. You'd be like, did I order
But it really ain't.
I hope that's mine out there. It's like, nope, it's not for me. So that was a fascinating thing. It was a fascinating moment. And I know you did it genuinely, right?
Definitely,
Of course,
definitely.
not to bring any bad or any ill. It was interesting. It was funny. It was all of that. So let's talk about you as a person, first of all. Tell the people, you're a Canton native?
Born and raised, man. Born and raised in Canton. McKinley, all the high schools, Belton Elementary, Hartford Junior High, McKinley High School. Shout out to McKinley.
Yep.
Bulldog for life. Born and raised in Canton, Ohio. Man.
Yeah. So, and you met your wife in high school? Is that right?
Junior high sweetheart, man. Going on 27 years
That's
of
not
marriage.
even a thing, my man. Don't be saying it like that's normal. My junior high sweetheart. That's on like Boy Meets World or some TV stuff. I love it. So you better in
Junior high school sweetheart, man. Junior high school sweetheart. Been together for 35 years now. Married, going on 27 years. I'll be 27 years in June, man. So
what is that like? Okay, so let's break this down, ladies and gentlemen. Okay. Because I'm like, we grow so much.
Right.
We all grow and change. We grow and change from our 20s to our 30s, our 30s to our 40s, right? So who I am now is not who my wife married. I got to be honest.
Exactly.
I'm not the same person. Not that I'm a bad person. I'm just a different person.
Exactly.
It's just a different person because life and experiences, raising kids and all the things of life have made us different. So then you got to keep resetting and recalibrating like, oh, okay, I'm here now. Okay, I do still like you. Okay, thank you. I'm glad you still like me, junior high. I mean, we don't even know who we are at all. How did you guys, what was that journey like?
Man, a lot of ups and downs. A lot of, typical relationship stuff, marriage stuff. People don't know, like, the thing about marriage, you have to be ready to see the absolute. You're going to see the best in the person, but you're going to be ready to deal with the absolute worst in the person, too. That's what a lot of people, so when people see the bad side or see that side of people that they never thought they were going to see, which was a lot in my case, where my wife seen a lot of, I did a lot of things that, wasn't supposed to be done, or man, like during the marriage, but she stuck with me during the rough times, during the times when I needed to grow. And a lot of people, that's why a lot of relationships don't last, is because people outgrow each other, or people don't want to see don't want to deal with that side of the person that they didn't think they were going to see.
Right.
But it was ups and downs, a lot of ups and downs. But I can say now that me and my wife are in probably the best place that we've ever been in after all this time, best place we've ever been in. So I love her just more as the same as I do today as I did 35 years ago.
That's absolutely beautiful. And you show it and you celebrate it. I think that's a beautiful thing too, because we need to see it, man. I feel like y'all have an anniversary every other month. I'd be like, it's the anniversary again. Because it's like, it feels like something for us all to celebrate, to see it and to hear the stories. And so tell me about y'all real quick. We're gonna talk about fitness too in a minute, but what do y'all like? Like, who's the silly one? Who's the more outgoing one? Because it seemed like she could get with you with whatever. Like, she could dance and have fun with you. But she also seemed like you just jump in the car and start messing with her too. Just don't care.
Definitely, I'm the silly one. I get on her. Some days I just don't know how she deal with me, bro. Like, she's my go-to for, like, when I'm in the mood to be silly. Cause I'm pretty much an introverted type, I can do well by myself alone type guy, but at the same time, I do get, I get my moods where I need to pick with somebody, and most of the time it's her.
It's her. She's sitting there.
Yeah.
She gets it.
She deals with a lot, bro, with me, and I don't know how she do it, but she's more on the serious side. My wife don't really like to play around that much, or don't, joke around too much, but I try to bring it out of her as much as I can. But most of the time when you see the videos of us in the car and all that, she's definitely not not with it, or she don't want to be bothered, but she just, because of me, she just goes, goes
Play
along
along.
with it.
And go with it because she loves you. I love love. That's good to know. Because she looked like she just with it. She like, this my guy. That's how it is.
Right,
I think that
right.
about my wife too. I'd be like, is she laughing just to laugh? Because you see, I'm a very serious person. I handle a lot of serious business, and really at the core though, I love to laugh and have fun.
Yeah, definitely.
And I'd be like, man, it's my wife. She's probably tired because she's much more introverted. She's super silly too, though. She's silly in her own way. She's silly right before she fall asleep. She be running around the house acting all kind of silly. And I'd be looking at my daughter like, your mom about to be asleep in about 5 minutes. She about to
Right.
fall down. But I love that. So let's talk about fitness. Like, how did you get into fitness? Is it something you've always been into? And then to take it from, I always think it's fascinating when people take their personal fitness to the next level and start helping other people with fitness. Because while it's something we all want to be better at or do better or have a plan
Right.
for, it's also something we quit every other week.
Yeah, definitely.
So it's a tough business.
Most people, the
when
consistency.
You're in the business of selling something that people swear they want, but then every other week they're like, nah, bro, I'm probably cool on that.
Man.
Let's talk about your own health and wellness journey, what got you here, and then what made you decide to help other people.
I've always been pretty active and in pretty good shape, consistent with my my health, especially my workouts and stuff. I've been wanting to do this probably 20, 25 years ago. God and my wife wasn't ready for me to do it. I was a different type of man. I couldn't network and deal with the people that I network and deal with now, or train, the people that I did now that I did back then.
Yeah.
It probably been, I wasn't the man that I am today. Right. So, my wife like, no way, you ain't training, you ain't doing that's
real, man.
Your shirt, you out here with your shirt off and all that.
And people
she used to never let me take my shirt off. Would want me to take my shirt off,
It was just for her.
Yeah, it was just for her. But as time got on, I would beg her. A few years ago by, I would beg her, no, we're not doing that. Lost my grandson 6 years ago, Ace Lucas, probably one of the biggest stories in
That
care.
was a big story.
But that just made me go hard, for real. Made me go hard.
I appreciate you sharing that. That was a big story and a tragic loss and so sad, man. My obviously every parent, grandparent, every greatest fear is losing a child.
Right.
I remember my dad, one of his friends lost a child, and he said that's out of order.
Right.
And I never forgot that. I was probably like 18 or 19. He said, son, that's just out of order. And then it made me realize that I want to go before, I want my parents to go before me as much as I don't want to lose them. And I did lose my mom 6 years ago. And of course I didn't want to lose my mom, but after having children, it would have been way worse to lose a kid or a grandkid. So definitely continue prayers for you and your family, because how do you continue to deal with that? Obviously, that's something that's still heavy on you.
Yeah, heavy. It's ongoing, man. Like I said, when I lost Ace, I didn't have social media.
Yeah.
I didn't have none of that. I despise social media. I mean, I didn't despise. It was the negative part of it that I didn't like. So when I lost Ace, I was like in a place where I was very introverted, like I said, but I didn't put myself out there that much.
Right.
I was staying in shape and doing the exercises and stuff like that, but I just didn't put it out there.
Yeah.
When I lost Ace, I said, you know what? It's time for me to be me.
Come on, man.
I need to stop worrying about what people say, what people think, and just go hard. And I was in a dark space. I was ready to crash out. So what I did was I transferred that energy into wanting to hurt others and do things to others, to just wanting to help others. And I felt like I had done enough hurt in my community, ripping and running my early years, gang banging and all that stuff. So I had a choice to either, like I said, crash out, go back to my old ways, or look forward and try to make the most out of a bad situation. And that's what I'm doing now, man.
That means so much to me, because this entire show came from the loss of my mom. 2020, my mom passed March 26, 2020. I started this show probably April 10th or something. It was within a week or so.
Mm-hmm.
Yeah.
I remember.
And it was using the pain to birth something great, because I said, what do I do with all this pain? It's like, it's only, all of it is just energy. Right. I just had all this energy. It was negative energy. It was pain. It was tears. It was hurt. It was a lot of stuff. But I'm like, I got to do something with this, because otherwise I'm going to go crazy.
Redirect it. You got to redirect it. Yeah. Or, and it's a pain you can't shake. 24 hours, you think about it all day long. No matter how much you try not to think about it, you think about it, So I just redirected it, man, and it's been a beautiful thing ever since, man. You know, staying positive, staying focused, staying consistent, and trying to not, change, make my life better, but just trying to change, make other people's life better, man. It's my main focus, my main goal, for real.
I love it. I love it. When you think about fitness, how does fitness play into your own mental health and wellness? And then how do you think it plays into others?
For me, it's like for situations like even with my grandson. Before that, I remember being in a deep depression. I wasn't about to when I was in high school. My senior year in high school, wasn't about to graduate. I got stabbed 9 times, ripping and running the streets. I remember sitting in the hospital in the deepest depression, and what brought me out of that depression is when I got well, I was able to work out. What brought me out of this depression, I was in a deep depression last time. Not point where I was going to give up, but just, depressed. Stopped working out for about a month and a half. Working out, I can say that fitness and working out is only going to make you feel better. A lot of times, like in situations, we sit and dwell in situations and we don't try to bring ourselves up out of them.
Right.
I've never went to work out or train and not felt better when I left, about the situation. I ain't saying that it's going to change the whole situation immediately,
Right.
but you'll find that as you're working on yourself, as you're building on yourself, and like I said, transferring this energy, this negative energy into positive energy or into a positive thing.
Yep.
What happens is eventually time heals everything, and it don't take away everything, but it's always in the back of your mind, and you're always going to deal with it. Yeah. But as time grows, we heal and make situations better. If we didn't let the situation, just take us all the way down. You know what I'm saying? So as the time went on, and I started healing, everything, you find yourself not only mentally better, but you're physically, you'll say like, man, you won't even notice that you was putting in this work because you channeling that energy. But after you channel that energy, man, you come up out of that situation feeling better. As time goes on, you say, man, I'm in great shape.
Right.
And that's what happened to me, man.
That's fascinating because first of all, I assumed you were always looking like this.
No.
When I'd be like, man, he came out the womb with abs. This brother rocked up out the womb and was like, did a sit-up, and they smacked him and he smacked it. I mean, like literally you were in such good, I'm like, man, it must be just like, I'm not that I don't think you work hard, right?
Yes, definitely.
I can see you do it, you put it out there, you show it, but I'm like, man, he must have just always been like this, never had a down season, never been off. He just let us see it now, but you've been through those seasons too.
I've been through those seasons, and what people, a lot of people think like people in shape or personal trainers, fitness influencers, they think that we don't go through those phases. Like we jump
like
up
it's all easy. Like you say no to the Oreos.
It's just as hard. It's just as hard for us as it is for everybody else. I have my days.
Mornings are still cold mornings for you.
Man, the motivation is not there. That's why I tell people don't rely on motivation.
Talk to us about that. What do you mean? What do you say to people?
Because a lot of people, I hear people say that I'm not motivated to go work out. I need somebody to motivate me. And when you're relying on motivation, a lot of times maybe I'm motivated 2-3 days out the week to go work out or go, do the things that I do. A lot of times you're going to have to do stuff that you're just not motivated to do, or get up and go to work when you just don't feel like going to work, And relying on motivation, you should rely on willpower. Your will outweigh your wants, man. When you rely on willpower to have the will to get everything done that you want to get done, so you can want to be in shape,
right,
and look in shape. Just don't have the will to go do the
work to get there.
A lot of people want to be rich. They just
got that right.
They just got the willpower to go do the things that it requires to be rich. You know what I'm saying? So your will is everything. When you start working off your willpower, man, instead of wanting to be in shape and wanting to do this, it's a game changer, bro, for real.
That's a great point, because I mean that same feeling of I wish I was more motivated. And a lot of times, I mean, I have this mindset in business. I was telling y'all today how I put these TVs over here because that's on a weekend. I'm in here figuring it out. It's still 6 years in, and I'm still tweaking stuff. Like if I push this button, if I put the light right there and angle the camera right there, It's a desire to be better and
Right.
do better.
We were
And
talking about that earlier.
absolutely.
And this is a beautiful setup, might I add.
Thank you so
Not
much.
trying to cut you off.
I know, I appreciate it, man. I appreciate it. It's a lot of work to get here and to really build a platform because that's my goal. And I told y'all that when you guys came in, I was like, really, for me, this is about other people.
Right.
And I don't, as if I want to shine, I could turn on the camera and just sit here myself and talk. And I'll do that sometime. If I want to do it, I'll do it. But I love bringing people on and hearing people's stories. So before we go, and we're gonna go a little bit past the hour. So if y'all got to go to work, just put the phone down on your desk. Don't get in trouble, but don't turn us off. Keep listening. All right, stay right here. If you're watching my replay, put replay in the comments. You alluded to a little bit of a rougher past,
Right.
and you don't have to share all of, but I think there's some people who could benefit from hearing. You were a different person. A comedian I love is Ali Sadiq, and he talks a lot about, like, he's been in prison. He talks about a lot about his life. My dad went through a lot of difficult things, and he is the man he is today because of things he went through. I'm the man I am today because of things I went through and mistakes I made. So when you talk about who was the old, was it Jason? Was it Jakey Jake back then?
What's crazy is, you see, I channeled, like I said, channel the energy. Jakey Jake.
Yes.
When I was ripping and running the game, it was rated R game for many, many years, or a couple decades. Whenever I did something like to, I'm gonna say, whenever I did something I wasn't supposed to do,
Right. It was positive like, to the culture. It was positive to the gang, but it was negative to the community.
There we go.
So you were celebrating that I did the thing that y'all like.
A couple of the guys would say it like that, Jakey Jake. That's how they would call me, Jakey Jake.
Okay,
and it got to the point when I left when I started making that transfer or changing my life, I would hate to hear that, Jakey Jake, or just the thought of that, Jakey Jake.
I didn't know that.
Yeah, I would hate to hear that. So I had to rechannel that. Like when I changed everything up and I started changing my life, I said, we're gonna take that negative of that Jakey Jake and I'm gonna take it to a positive. So I started, I implemented that into my, my show, into my workouts, into my content, and people just grabbed onto it immediately. The Jakey Jake. Some people couldn't stand it, but some people was like the Jakey Jake part. I love that the most, So
I loved it.
Now I'm just, it's part of the what I do, and I switched that from a negative to, changing it to a positive. For real.
I love that, and it's my favorite thing. It makes me watch the video to the end.
Right.
So one of the hardest things in social media is retention. You got to try to. The longer people watch a thing, the more it shows it to other people.
Right.
So I'm watching the thing, and I'm like, whatever you saying, I'm into it. And then I gotta wait for that part at the end. It's like the hook. Oh, I'm like, man, this is so good, man. I need something like that. I'm working on it. I gotta figure something out. I'm about to be Jakey Jake Jr. I gotta figure something out. But I really think it's excellent. One more thing, content. It's interesting to hear that you're more of an introverted person.
Right.
Like, I didn't know that. But you put yourself out here on social media. Talk to us about the impact of on your life, your business. Kind of how has it been a positive for you in doing that?
Man, it's really, for me, social media for business, networking, and promotion and stuff like that, it's a beautiful thing to be able to do it on your own. If need be.
Yeah.
But it's just been great for business, great for networking, getting to know different people and what they got their passions want to do. So it's been just great as far as, I had no social media page, like I said, 6 years ago. Wow. So I'm just really just climbing. Everybody was like a decade ahead of me or something like that. So my wife used to be on social media. I never used social media, but since it's been a huge impact for me, like as a person, business, I can get on social media. And the one thing I want to say is, like, you really can't care about what other people say or think, because it's always going to be people that's I'm not say hating, because sometimes people think people is hating on them and people is telling the absolute truth about them. You know what I'm saying? But sometimes you will have haters, or people just don't like your content or don't like what you're doing. Don't worry about those people. Push hard, stay consistent, and stay motivated. And positivity and promoting positivity. You'll never hear me hate on another personal trainer. You never hear me hate or talk about nobody, man, as far as like trying to bring their business or what they trying to do down. My grandma always used to say, if you ain't got nothing good to say, don't say it at all. You know what I'm saying? So I won't say nothing at all before I hate on it. But stay positive and don't let the people that don't want to see you, the naysayers, the people that don't want to see you, the critics don't want to see you thrive and move ahead. Don't worry about them, man, because everybody gonna have them. I don't care how rich you is and how broke you is, man. You gonna have people that don't want to see you make it, man, for real.
I love that. And that sounds like one of those Jakey Jake moments that you give us. He gave us one here live to keep us motivated, keep us going even beyond motivation, to take something and build in that willpower. Let's talk lastly about fitness. Where do you train at? Can people still get with you? Are you booked up? Is it some room for some more clients?
Man,
A group class coming soon. Can we
got-
do it virtually? Can I have you in here training? What can we do? What you got going on?
I got a full roster right now, except on the weekends. I try to dibble and dabble with people, man. But
That's a
I'm
great
trying
thing.
to create a bigger space, I'm right now I'm at the Southeast Community Center for the most part. And I'm like that, bro. I got my certifications and once I got my certifications, I went straight to I want to walk amongst my people, man.
Yes,
for real. Like
I love that.
I'm not a racist bone in my body. I wasn't born racist, not prejudiced, none of that, man. But I just love my people, man.
Yeah.
So I feel like I want to be amongst my people, help my people. And I feel that's where I did the most of my negative stuff when I was earlier. So I want to try to give back and help my people. So that's really why I base myself right down there. I could easily be out in one of these big chain
fitness places,
anywhere. But I want to be right there in the heart of the, you know what I'm saying, where it's at for a little while. I'm going to expand, but right there, Southeast Community Center, man. Inbox me. I do some home, like home training and stuff like that.
Yeah,
but
put a plan
for the
together.
most part, right there, Southeast Community Center, man. I got clients. I'm overloaded with clients and people helping people, but it's a good thing and it's a good feeling, man, for real, bro.
You know how many people wish in their business they are, I mean, what a great thing that you're doing. You just got to raise your prices. That's all. That's the only way. That's the only way.
That's the thing. My prices are so affordable, bro. And if the situation, if I see a situation where I train people, some people I train, I don't even charge them, bro, because it's just some situations that, I just want to help, man. I just want to give back. So I'm giving back as much as I can, trying to stay positive. You're always gonna catch me positive, faithful. Keeping the faith is huge, man.
Yeah.
And trying to do better, man, as a man.
I love it. Ladies and gentlemen, it's Jakey Jake.
Appreciate you.
In the building. Thank you so much for coming on.
Thank you.
It was wonderful having you. Thank you for sharing our insight. Can we get a Jakey Jake one more time for the people?
Jakey Jake.
Let's go. Ladies and gentlemen, Jakey Jake is in the building. I'm so excited to have him here, everybody. We're going to wrap it up here this morning. Thank you guys for being here with us on another episode of Lucas Live. If you haven't watched the whole thing, go back and watch the replay. We're going to cut some clips and put some clips out there, but that's just to get you excited to watch the rest of the episode. You can follow us on YouTube at Lucas Live Media. Follow me at Lucas Tyndale. Follow us everywhere. We got a lot going on, a lot coming out. This Saturday, Harold Fannin Jr., Kent McKinley graduate, Cleveland Brown, superstar tight end will be at Two Scoops here on 5th Street downtown this Saturday at 2 p.m. Make sure you guys come out and check out his special flavor of ice cream he made right here. All the ice cream at Two Scoops is dairy-free and gluten-free. And I know some of y'all is like, that's going to be nasty. I promise you, it's the best ice cream you've had, and your stomach ain't going to be messed up. Especially our people. We got a lot of, I bring Doc back on to tell y'all about y'all lactose intolerance that y'all been tolerating, and your stomach's so messed up after you go to the Dairy Queen that you can't even sit with your family. So we want to make sure y'all go down there to Two Scoops, get a couple of scoops, meet Harold Fannin Jr. this Saturday. We also have Kent McKinley's prom. We'll be back for the red carpet experience this Saturday, 7 p.m. Make sure you guys tune in to Lucas Live Media. We're going to be there interviewing the kids. They're going to be dressed. We got a special... We about to try something new this year. We haven't even tested it yet. We're going to be testing it live. We're going to be doing a 360 camera live on the show outfit check with the things spinning around on the show. We haven't even figured it out. We're going to figure it out literally live that day. We might go on Friday and test it there. I don't know. We'll find out. But ladies and gentlemen, make sure you guys plan to check us out there. And we'll be back this Wednesday. High school senior Dejan Dickerson will be in the building making his announcement about what college he's going to. And we also have Wendy from Centennial Plaza coming to tell us about all the events going on down here this summer. So you guys make sure you, your family, and friends can make sure you guys have something to do this summer. Ladies and gentlemen, it's my pleasure being here with you. We'll see you on the next episode of Lucas Live. Everybody have a great day.